Hi, everyone. Welcome and good afternoon. Thank you for joining us. Next slide, please. And welcome everyone to this afternoon's webinar. This is the New Jersey Comprehensive School-Based Mental Health Webinar Series, and this is session 8, collaboration with systems partners. Next slide, please. This webinar is sponsored by the Northeast and Caribbean Mental Health Technology Transfer Center in collaboration and partnership with the New Jersey Department of Education. The Northeast and Caribbean MHTTC is housed at Rutgers in the School of Health Professions in the Department of Psychiatric Rehabilitation and Counseling Professions. My name is Kathy Rivera, and I am the project coordinator of the center, and I'll be introducing our center and our webinar presenters for today. Next slide, please. And if you're interested in staying up to date with the events and products that the Northeast and Caribbean MHTTC is providing, we invite you to sign up to receive our email communications, and you can sign up in the bit.ly link that you see on the screen, and it's also provided in the chat box. Following this webinar, you'll be asked to complete a brief survey. We value this feedback and use it to improve our activities and inform our future activities and products. The surveys are also important because our continued funding is linked to the completion of these surveys, so we thank you in advance for your feedback. We also want to let you know that this webinar is being recorded and will be posted to our website along with the PowerPoint slides in the next 7 days. This presentation was prepared for the Northeast and Caribbean Mental Health Technology Transfer Center under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, or SAMHSA. All material appearing in this presentation, except that taken directly from copyrighted sources, is in the public domain and may be reproduced or copied without permission from SAMHSA or the authors. Citation of this source is appreciated. We ask that you please not reproduce or distribute this presentation for a fee without specific written authorization from the Northeast and Caribbean Mental Health Technology Transfer Center. At the time of this presentation, Miriam Delphin Rittman served as Acting Assistant Secretary for the Mental Health and Substance Use at SAMHSA. The opinions expressed herein are the views of the speakers and do not reflect the official position of the Department of Health and Human Services, or SAMHSA. No official support or endorsement of DHHS or SAMHSA for the opinions described in this presentation is intended or should be inferred. Next slide, please. We encourage you to interact with our presenters during the webinar by using the chat feature. Please post any comments or questions you have in the chat, and I will collect your questions as we go and ask them of the presenter during the Q&A time towards the end of the presentation. During the webinar, our presenter may post questions or polls to you, so we invite you to please answer them using the chat or the poll functions. Next slide. Now let's begin our webinar session. We have Sonia Rodriguez Marto with us today. Ms. Rodriguez Marto is a licensed professional counselor, a national certified counselor, and an approved clinical supervisor. She is a director of school and community-based programs at Rutgers Health University Behavioral Health Care, which provides professional development and intensive mental health services to at-risk youth in public, private, and out-of-district school settings. She is also co-owner of the Center for Intrapersonal Wellness and has served as an adjunct faculty member at Monmouth University and at Middlesex County College. Sonia received her bachelor's degree in psychology from the College of New Jersey, a master's and postmaster's degree in psychological counseling from Monmouth University, a master's degree in forensic psychology from John Jay College of Criminal Justice, and a master's degree in clinical psychology from Fielding Graduate University, and is currently a PhD candidate at Fielding Graduate University. She has presented on a variety of workshops on topics related to stress and anxiety among teens, integrating mindfulness practices in school, completing suicide risk assessments, non-suicidal self-injury, and on treating survivors of sexual assault. Her clinical research interests are within the areas of acculturation among Latino populations, multicultural factors in counseling, working with teens and young adults on life transitions and career exploration, self-interest behavior and risk assessment, sexual abuse, trauma, and factors related to resiliency. We also have with us today Principal Alfonso Ganella. Principal Ganella serves as the principal of Copeland Middle School in Rockaway Township. Principal Ganella has 19 years of experience as a high school history teacher, high school principal, and middle school principal. His teaching experience was at Bloomfield High School and Bridgewater Raritan High School. He served as vice principal of Nutley High School prior to arriving at Copeland Middle School. Over the course of his career, he has worked with students, teachers, administrators, and parents to develop and implement curriculum and practices that include social and emotional learning, mental health and wellness, character education, standard-based instruction, and appropriate technology integration. So again, welcome everyone, and welcome to our two webinar presenters, and I will turn it over to them.
Great, thank you so much for that introduction. So happy to be here today to talk to you about some of the ways in which school districts can collaborate with community providers, community agencies, in an effort to enhance services provided in schools. So the goal of collaborative school-based mental health services really includes strengthening both school and community partnerships in an effort to provide much needed services and supports to students, families, and to staff members. The goal is to really provide a very comprehensive approach to supporting all students, essentially general education and special education students. And by providing these services in the school district, we're able to really capture so many different things that the child is involved with. We have access to a child's coach, their teachers, their school counselor, their child study team case manager, their school administrators, sometimes the school nurse, the occupational therapist, the speech therapist. So really being able to capture all of the information about how to successfully support each and every student. And this approach really helps to ensure that children are being able to access treatment. As we all know, many times we can provide a referral list, a name and a phone number to perform care, to an outpatient provider, and it doesn't always pan out. Sometimes there's long wait lists, sometimes the family doesn't follow through, they're unable to pay for the copay, maybe there are some challenges with transportation, maybe there's some difficulty navigating appointments and finding appointments after school hours. So being able to provide a wide variety of programs in schools has been shown to be very, very helpful in supporting students with their emotional health as well as their academic success. So today we'll talk a little bit about different tiers of programming and how to be able to provide extra levels of support to students, as well as how to enhance existing services in schools. Specifically, we'll talk a little bit about providing support to at-risk students, although I will say during the post-COVID era, all students are in need of support. Next slide. So as I mentioned earlier, schools are the ideal place for mental health and behavioral supports because we have access to so many different school personnel. Students can receive a full continuum of services. They can access services before school, during school, after school, and over the summer as well. Some of the programs provide support services over the summer. So programming really emphasizes a shared responsibility in an effort to fill in the gaps and ensure students don't fall through the cracks. So this happens a lot when we refer students out to an outpatient provider or to a program, and there isn't necessarily the same follow through. When you have a student connected in school, the hope is that everyone is talking and communicating to each other in an effort to ensure that the student is receiving the support that they need and no one falls through the cracks. A strong connection between schools and the community agencies really helps the school to move towards a collaborative school-based mental health services model. This also ensures that wraparound services are provided to support the whole child and the family. So a lot of the community agencies have a pretty strong family component, which is critical. We can't just work with the child. We have to make sure that we're working with the entire family and making it a priority to offer families an opportunity to meet with the counselors as well as anyone else in the school in order to ensure that everyone is working together to support the whole child. Next slide. So we're going to talk a little bit about different models. Model 1 refers to community-based providers, so referring to designated community-based providers who are providing the service and then will consult with school districts. Model 2 is a community mental health and behavioral co-located in schools model, where they are physically housed in the school setting. Model 3 is a community mental health provider that is a full collaborative partner, so 100% dedicated in the school setting, providing services typically from anywhere from 10 to 12 months a year. And then Model 4 is the telehealth option. Next slide. So where do we begin? It's super important to first identify what the needs are. So a lot of agencies will start with a needs assessment, really outlining what are the needs of the school and the community, what services or supports are currently in place and what supports are still needed. So an introductory meeting is very helpful to just start the process of identifying what does the school district currently have, what are the needs? How are you meeting those needs for each of those students? How can you supplement services? And then also, how can you support existing staff with being able to handle some of the issues that are coming up? So how do you provide that professional development and staff support so that they feel comfortable and confident in how they're providing services to at-risk students? So it's super important to really look at a resource mapping to really identify any gap in existing resources. Sometimes you can look at a partnership with an agency who bills for insurance. So we'll talk a little bit about that. Other options include a full service model. Sometimes there's an opportunity to just contract with an agency to come in, provide training in an effort to give the school staff confidence and strategies for how to navigate certain situations, and also talk a little bit about some of the resources that the school staff could provide to the students and families who they're concerned about. So another approach is to move in the direction of really developing a very comprehensive school-based mental health team, where they have different varying roles of support. And this includes significant community collaborations and providing opportunities for the implementation of school-based mental health to occur in the school setting, as opposed to referrals to the outside agency. Next slide, please. All right, so we'll talk a little bit about how to provide some of these services within a multi-tiered systems approach. Next slide. So Tier 1 support involves universal interventions, primary prevention, and promotion of some of the existing programs. The kinds of support that can be provided is professional development to teaching staff, as well as counseling staff and sometimes nurses. Some of the trainings that typically recur revolve around creating a trauma-informed school environment, suicide prevention and awareness, understanding depression and anxiety in youth, strategies for self-care and emotion regulation, strategies for incorporating SEL, social emotional learning, within the school. Also things such as mindfulness strategies in the classroom, utilizing the nurtured heart approach, and strategies for managing challenging classroom behaviors. So that would be one part of the Tier 1 approach, is how do we address issues that the staff are having and how do we help them provide strategies to their students who are struggling. We also look at possibly utilizing a social emotional learning curriculum that's embedded in classroom discussions. So sometimes schools will look at the CASEL model. That's a very popular model that school districts are utilizing, and teachers are taught how to incorporate some of these lessons into their existing classroom lessons. The other thing with Tier 1 support is looking at a family engagement model. So how do we engage families? Sometimes you could look at utilizing a family support specialist who can really help provide case management to families. So maybe they need support with linkages to both physical and mental health services. Sometimes families need support with housing, food or childcare needs. Sometimes you can look at providing educational family nights to families to be able to provide a school and family connection. Next slide, please. So a Tier 2 level of support really looks more at providing secondary interventions for students who don't necessarily respond to the universal supports or are at a greater risk for developing mental health concerns. This also can include significant prevention programming, where we're really encouraging lots of programming to occur after school hours, during lunches. A lot of times we look at running significant groups and co-facilitating groups with child study team members and school counselors. We look at providing mentoring programs with older students who are mentoring and supporting younger students. And we really look at including classroom-based supports. Sometimes we've been able to utilize what we call the youth development coordinator, who really looks at providing psychoeducation programming during school lunches, as well as after school programming. A lot of times we know that students don't have healthy and supportive things to do after school. So we want to be able to provide them with a place to go and an opportunity for them to connect with other students, but also to participate in workshops that might provide them with prevention techniques and topics that might be relevant to them with regards to developing healthy relationships and making healthy choices. Youth development coordinators can also develop school-wide initiatives. Sometimes they've been able to do things such as wellness events, or team building events. The goal of this programming is really to spread awareness and provide information on topics related to mental health, emotion regulation, kindness, and inclusivity. At times, a Tier 2 level of support could also include adding the role of a mental health clinician. This clinician could work with at-risk youth to provide individual, group, and family therapy. A lot of the group work is emphasized at the Tier 2 level. And so a lot of times we look at providing groups on topics such as managing stress and anxiety, social skills groups, how do we manage their emotions, self-esteem groups, and mindfulness groups. Next slide. So Tier 3 is the highest level of support that a school could provide. A lot of times this is really where they look to contract with an agency to be able to provide a higher level of support services to their students as well as to the staff. And so this might be in lieu of sending kids out for crisis assessments or referring kids to an outpatient therapist, or even sending kids out of district. So the Tier 3 really responds to individualized needs of the 5 to 10% of the students who don't respond to the other support. So really looking at your highest risk students and how do we support those kids. These are the kids who are school avoidant, kids with significant behavioral issues who aren't coming to school or getting suspended often. How do we support those students? Some of the community agencies will also provide in-house behavioral supports so that you don't have to send some of these kids to an out-of-district placement. It's much more cost-effective to keep kids in district as opposed to sending them to an out-of-district placement where the child feels disconnected from their school community. So these supports really look at providing intensive individual work, group work, and family therapy. We really look at creating individualized treatment plans. So my favorite aspect of Tier 3 level of supports is really designing what each individual child needs. So you could have a clinician who's seeing a child twice a week. You can have another child whose needs require them to check in every day for 20 minutes because they have significant school anxiety. You could also craft an intensive outpatient model where a child might be coming in 3 days a week after school. So this really lends itself to really being able to provide significant supports based on what each student needs. Sometimes a behavior plan is put into place and the student and the family is aware of what's in the behavior plan. What are some of the rewards that might be in place if a child is successful in managing their behavior plan? This includes significant amount of family and caregiver support. So this might include evening sessions, whether it's in the school or in the community, in an effort to really connect a child with their family and really look at family dynamics. And this is also inclusive of a collaboration with community providers. So really looking at how to ensure that a child and a family is connected within their community and accessing the highest level of support. So this might be a child who has a CMO in place, care management organization in place, or with mobile response services. This might be a child who is also receiving significant amounts of support through FSO, Family Support Organization. So really just making sure that a child is connected with the highest level of services. So once a student is deemed eligible for Tier 3 mental health services, typically the clinician will really work to identify a comprehensive treatment approach where all of the partners are aware of what's happening and what the goals are. So this would include the child's school counselor, a case manager if they're classified, a school administrator might know what the goals are, and then the family. Next slide. Okay. I'm going to talk a little bit about what collaborative teaming looks like. And so this is really the key to success, is having everyone on board. So the integration of a successful collaborative school-based mental health program really relies on constant communication, ongoing collaboration with school staff, with teachers, child study team members, the school counselor, the nurse. We feel like a school nurse is an integral part of the team, the administrators, as well as the student and the parent. And a lot of times what we try to encourage is that this happens pretty regularly. So whether it's a bi-monthly meeting that occurs to ensure that you have an opportunity to talk about all of the students that you're concerned about, and then how each person is going to come together to help support this child. It also is an opportunity for the clinician who might be working with the child to really give an update on how that child is progressing in therapy.
And Sonia, it's so important to mention. Hi, everyone. Alfonso, principal of Copeland. Sonia and I have been working together. I think this is our 5th year, heading into our 6th. And I cannot stress the importance of the collaborative teaming approach. You know, from the top down, Sonia and her team working with our team and really clearly defining the roles of the school counselor, the role of the child study team, and really having the entire unit operate as a cohesive group, which you'll see a little bit later on in the presentation with Sonia and her team and what our team been able to do is really integrate the Rutgers program as members of our school community. And you'll see in order for this to truly be successful, that clinician has to be a part of your school culture and climate teams, your counselor meetings, your CST meetings. They really have to engulf themselves, into the entire school and every component of it. And what you'll see throughout this presentation is that thread of collaboration, the thread of community, and really that whole group approach. And so I just wanted to add that in there. Thank you, Sonia.
Thank you. It's some important points. So really building the relationship with the school community. I always say to my team members, if they are often mistaken as a school staff member, that's the best compliment they can receive. That means they've really integrated themselves as an outside provider into the school community. They're encouraged to participate in community events, collaborate very often with the school counselors as well as the child study team members. I know that clinicians that we have who are working at Copeland are constantly collaborating with everyone in the building for parent events, co-facilitating groups, and collaborating with additional partners, community partners that Copeland is working with. So really being able to sit down at the table on a regular basis and talking about all of the supports that are in place and what are the updates, and making sure that each and every child that has been put on the radar or referred to that outside provider, we're constantly checking in. How are they doing? Are they continuing with treatment? Are they participating? Has the family been on board? Do they agree with services? All of those things are important. We all know that children thrive when everyone who plays a role in their lives is working collaboratively to support them. So super important to make sure that that communication is happening. And we know that sometimes it's easy to forget to provide somebody with an update. So really making sure that these bi-monthly, sometimes even weekly meetings are occurring with the overarching goal of making sure that these students are brought up, the progress is discussed, and everyone knows who's working with the child and who's providing what level of support. Next slide. So all of the benefits of collaborative teaming are really about building connections, strengthening engagement, both with the child or the student and the family. It really reduces the stigma around mental health issues and improving access to care. So knowing that a child could see a mental health professional, even sometimes a child psychiatrist at the school, really helps to destigmatize mental health. It feels less invasive. They don't have to walk into this hospital setting or a community mental health agency, that they're able to access these services right in their school community. It's an opportunity for community partners to support and advocate for schools with other policymakers. It really looks at being able to provide an expertise with outside mental health providers, identifying evidence-based interventions that fit the needs of a student population, and also helps to decrease the risk of over-identifying students. So the thing that's really important is that sometimes those kids that are really presenting with significant behavioral issues, those kids that are throwing chairs, the ones that are school avoidant, those are the ones that are on everyone's radar and often receiving a tremendous amount of services. So it's really important to make sure that we're not over providing services, that a child doesn't have two therapists. There's no reason why any student should have 2 therapists. So if they're already working with someone, that should be their primary provider, because there are just so many needs, and we want to make sure that we're also looking towards a preventative approach. So if someone's just starting to show some signs of, struggle, that we want to make sure that we're able to provide them with the services and not waiting until it's getting out of hand. Next slide. So family and student engagement is really key. We need to make sure that we're engaging with families. And one of the things I love about this work is that by offering it in a school setting at no cost to families, often it really helps to engage with the families. So they understand that this is an outside provider who's just being housed at the school and integrating with the school, but able to provide these services often at no additional cost to the family. So that has been very, very helpful. It helps to increase the family's connections with the school. Sometimes we look at sending out a parent survey to help identify some of the needs. One of the things we have seen is that being able to provide workshops and parent events virtually has really increased the number of parents who are joining and participating. It's just made it easily accessible to parents who don't need to worry about getting childcare or commuting from work, leaving their families. So they're able to just kind of log in to some of the parent workshops. And we've seen so much of an increase in participation in our family events. So one of the things that we like to focus on too is the parent events or a parent night out, wellness events. These things have all been very, very helpful to just help the family understand the services that are provided, both within the school and within the community, because it can be difficult to navigate the mental health system. I know a lot of times parents are given the Perform Care number and it can be overwhelming. They're asked so many questions when they call. They're then given another provider, and sometimes they don't understand the process. So it's helpful to be able to have somebody who can understand and walk them through that process, or even call with them. Meet and greets or introductory meetings with school-based staff helps. A lot of times we encourage the staff who are contracted in the schools to participate in back to school nights, to go to the PTO or PTA meetings so that they can have an opportunity to introduce themselves and talk a little bit about the services that they provide. Next slide. So cultural considerations, we need to make sure that all programming is offered with a culturally sensitive lens. A lot of times trying to find providers who understand some of the cultural implications. A lot of families have certain beliefs, cultural beliefs about mental health and mental health services. So really making sure that the culture strongly impacts the work that we're doing and that we're being mindful of all of that. Particularly when working with immigrant and undocumented families, there's an initial level of distrust and wariness about the services that are recommended. So a lot of times it's really important to spend significant amount of time just talking about how these services are meant to just help support them, and that no documentation will be requested. They don't need to provide us with any documents. So super important to make sure that families know that. Next slide. So some tips for successful collaboration. You really want to look at selecting team members within the school who has knowledge of specific competency areas. You want to really look at key policies and laws that need to be taken into consideration, interprofessional and cross-system collaboration, evidence-based practices. You need to look at making decisions based on data and trends. So I remember, one time where every 7th and 8th grade girl that we were working with had some had some issue related to self-harm or cutting. So that became a trend. So we really needed to look at how we're going to help support the students at this grade level in providing the psychoeducation and supports for these students. So really looking at some of the trends that are coming up within the school district, looking at personal and professional well-being and cultural responsiveness. So really making sure that you have a very comprehensive team who's coming together to talk about what services are needed and how to create a model that works for your school district. Continuous coaching can be provided to build the sustainability and capacity of the school community. So some of the providers will contract with school districts to be able to provide consultation and support in an effort to ensure that there's sustainability of the program and a way that enhances the existing school staff members and being able to make sure that they have the support they need and the professional development that they need to feel comfortable and confident in navigating some of the most challenging situations. Next slide. So here's just a little bit of a brief list of some of the important New Jersey resources. The Traumatic Loss Coalition is crucial. They really help support schools at no cost whenever there is any kind of traumatic loss. Central Jersey Family Health Consortium, they offer a variety of resources for families. A lot of their initiatives are related to helping pregnant teens and prevention and early intervention resources. They have a teen health initiative. Second Floor Youth Helpline, they're incredible. This is really, really helpful for a lot of the teens. They have an opportunity for kids to text in any concerns or how they're feeling. They get connected with someone who's trained, who can really help with some of the suicidal thoughts that they might be experiencing. It's a great resource. And then obviously the Children's System of Care, who's committed to providing services based on a family-centered and community-based approach. And so they offer services to children up to age 21 related to behavioral health, substance abuse, and developmental disabilities. Next slide. And I'm going to pass it along to Alicia, who will facilitate the team reflection questions.
Thanks so much, Sonia. So before we turn to our school exemplar in just a moment, I'd just like to share some reflection questions that might be helpful in the planning process when developing community partnerships. And some key questions might include, what are the greatest needs in my school district? And what components of a school-based mental health program would meet those needs? What are some of the current resources? What are our current resources and what services are needed to enhance those existing resources? How do we create and implement a program that focuses on prevention, early identification, and intervention? And what types of training do school staff need to enhance existing services so that they can provide additional support to identified students? So these and other helpful reflection questions are contained in Chapter 9 of the New Jersey Comprehensive School-Based Mental Health Resource Guide. And I just want to show you to access the guide. You can use the QR code here or the link that will drop in the chat if someone can do that, please. And to learn more about collaboration with system partners, please refer to Chapter 9 of the guide, and you'll find there some additional team reflection questions, hyperlinked resources, and also practical school-based examples. And now I'd like to turn things over to Principal Ganella with the Copeland Middle School in Rockaway Township School District. And thank you very much. I'll leave it to you, Principal Ganella.
Thank you. Hi, everyone. What I'm going to do is I'm going to work through the reflective questions as we go through the presentation. So next slide, please. Just a rundown. Copeland Middle School is located in Morris County. Like many Morris County schools, we've had a population boom. We're at 878 students. We had 120 new students enroll in the district after July 15th. We house grades 6, 7, and 8. We have 115 teachers and support staff in the building. And our school meets the need of a diverse community of students and families. Slide, please. So I think it's very important to look back at the reflective questions. And question 1, what are the greatest needs of my school district? What components of a school-based mental health program would meet these needs? We are a survivor school. We had a suicide 5 years ago, June 14th, 2017. So when you're coming in and you're contracting with a mental health program like Rutgers, it's very important, as Sonia said, to really be honest with yourself and conduct a needs assessment of your school. I think it's very important for us in our school. We pride ourselves on being anti-buzzword. You know, we're in a community of lifelong learners, change agents, put children first. The first step is really asking yourself, what does that mean? And how do we execute it? I think it's important if you look at our mission statement, which our Rutgers team was a part of because they were part of our school community. The big piece is empowering all individuals, students, parents, teachers, counselors, to be their authentic selves. What is the baggage that we bring in the building? How does that shape who we are? And then how do we cater our program to that? So that's extremely important. Then looking at, what are our current resources? Most schools do not have a program like Rutgers. And Sonia mentioned this early on, is that how do we service kids in the building? How do we establish partnerships with families? We speak in the world of risk assessment. My experience prior to implementing this program was, a risk assessment team would conduct an initial screening. If there was a higher level of care needed, those students would go to the local emergency room. In this case would be St. Clair's. As you all know, that could be a very tedious experience for families. Students going to an emergency room, spending upwards of 4 hours, in that facility, and sometimes not getting the care or the personal care that the child needs. So, really looking through that and how you bridge that gap and build that partnership is something that Rutgers and Rockaway Township have been able to do. Next slide, please. So our core values that we believe in are honesty, empathy, acceptance, responsibility, respect, and trust. Slide, please. Kind of to that point, we had an uptick like many schools, 2017 and 2018, 45 risk assessments, and 2017, 2018, 2019, 55 risk assessments. So looking at that data with our Rutgers clinician, our model was to really educate our student body, our faculty, and our community on mental health and really debunking the stigma that comes along with that. The great question is, how do you do that? Next question. Oh, I'm sorry, next slide. Doing that is really making this partnership ingrained and embedded in your school community. So if you look at the Courage Project, which we'll go over, how does that work with our existing partnerships with the Rockaway Township Substance Abuse Alliance? How does it work with our parent-teacher association, our PTA? And how do we use that as a vehicle to get our message out and really debunking the stigma that surrounds mental health? Next slide, please. So the Courage Project, which is compassion, optimism, unrelenting resilience, gratitude, and excellence, is a partnership between Copeland Middle School, the Rockaway Township Board of Education, and Rutgers University. The purpose of the program, as Sonia said, is to provide evidence-based mental health treatment to students in a safe and comfortable setting. Not an emergency room, not an outside facility. Program goals is to enhance the opportunities for student learning by providing free mental health programs in a non-threatening and familiar environment, and to provide these services to children who have limited access. And as Sonia said, it is so important not to overextend the resource that, students who are already linked to services might be more in line for a case management component as opposed to in-school therapy and at-home therapy. Slide, please. So the components that Rutgers offers and the Courage Project offers is individual, group, family therapy, crisis intervention screening, substance abuse identification. A big component is the consultation with our CST and our counseling staff, case management and referrals to community providers, conflict resolution, support counseling, professional development, and parent education and workshops. And I do want to spend a little bit of time, talking about that. As I mentioned, our clinician is a well-known member of our school community. They are not someone who operates in a silo, and the program itself does not operate in a silo. Sonia mentioned tier 1, tier 2, and tier 3 interventions. Oftentimes we spend a lot of time discussing the tier 3 interventions, which we will cover. That is that really select or small group of students who are on the Rutgers caseload. We're going to spend a little bit of time in the tier 1 and tier 2 component and how our Rutgers clinicians help us in that area. So we've been very fortunate enough to have great clinicians and a great counseling team that implements the state of New Jersey's program called the Sandy Hook Promise. If you're not familiar with that, essentially every student in our school receives an initial screening from a member of our risk assessment team. Our Rutgers clinician helps us in the planning component of that and the operational component. How do we administer 878 risk assessments or initial screenings to every student in the school? As we roll through that program, that's really an identification process of who are students that the school district has not identified as someone being in need of a more intense level of care. Who are the students that would benefit from groups, and what are these groups that we're running? We do that every year, middle of September, and that really helps us kind of get an overarching need of our students and the support that they need, and it creates a dialogue between the school and community around mental health. And the Rutgers clinician plays an instrumental role in that. On the tier 2 side, we look at things that Rutgers helps us with, leveraging our community resources. In Morris County, we have an organization called Prevention is Key, which is an organization that provides group therapy free of charge to students after school, 1 hour, 2:30 to 3:30, 2 to 3 days a week. So our counselors, our CST, and our Rutgers clinician go through our data from our Sandy Hook Promise and our SEL competency surveys, and we develop cohorts of students that are linked to free services after school. Our tier 3 intervention is our Rutgers program, and that services a very small group of students in our school. In our school, it's our students that are at high risk, for suicide or have underlying mental health conditions that ordinarily would not be serviced in a school setting, fall on the Rutgers caseload. Next slide, please. As I mentioned earlier, the Rutgers clinician, works with not just our school, but with our community partnerships. Slide, please. Next slide. When we talk about the expanding of the mental health resources, our Rutgers clinician also is intimately involved in all of our building initiatives. one of our initiatives over the past 3 years was building a restorative school. And what does it look like, and how does that service and support the mental health component? And as we discussed, in order for this program to work, it's predicated on strong relationships between upper administration on the school side and the Rutgers side, and really breaking down those walls and barriers. So Sonia and her team have fully immersed themselves in every initiative we have going in the building. We received a distinction of a National School of Character. That was based on restorative practices and our work with Rutgers Mental Health and Wellness, as well as our work with Sandy Hook Promise. Next slide, please. So what are the challenges when you come into it? Well, the big challenge is having a staff of over 100. And as you know, oftentimes, people come in with their own beliefs that might run counter to the work that we're doing. The key is that any training, any message cannot be a one-off. Doing an opening day presentation on debunking the mental health stigma is not enough. Our Rutgers clinician, along with our counseling and CST team, which is our mental health and wellness team, have an allotted amount of time at every faculty meeting. So we have 2 faculty meetings a month. And in those meetings, we have a variation of mental health trainings, strategies that can be used in the classroom, but also staff mental health and wellness check-ins. In order to support the students, we have to support ourselves. So our Rutgers clinician is accessible to our staff, provides consultation to our staff, and so our staff can really see the work in action. Everything we do runs through the mental health component and relationship building. The key way to knock down those walls is really dedicating the time and professional development to your staff, because they're the ones that are on the front line. Our next piece is, how do we get our families involved? How do we debunk this in the community? Next slide, please. 4 times a year, we dedicate to family nights at Copeland Middle School. Family nights were developed in conjunction with our Rutgers partnership. And the focus behind it, one, was disconnecting our students and adults from technology and social media, and spending time together to focus on core family values. The first 20 to 25 minutes of each presentation is our Rutgers clinician providing information and professional development to families. It could be things like mindfulness practices. It could be things working on stress and anxiety of homework. Whatever our SEL surveys say and our team says really kind of drives those presentations. And they are run in conjunction with our Rutgers clinician and our mental health and wellness team. I'm proud to say we had our first in-person one of the school year 2 weeks ago. We had over 185 families in the building, working with our mental health team. So, really proud of that work, with Rutgers, really providing, authentic and relatable professional development to our community as well. Something else I'd like to add in here is that a big work that Rutgers has done. They've been part of our team to revamp our risk assessment protocol district-wide. In order to do that, we assembled the risk assessment teams from all of our elementary schools, 5 elementary schools and middle school, and really broke down the existing protocol and really developed an understanding if the protocol fit the needs of the teams. Rutgers worked with all the risk assessment teams to rewrite the protocol. We embedded the protocol in policy. We also made a commitment that the staff would be trained district-wide 3 times a year on risk assessment, implementation, resources, communication. So we spend 3 professional development days training those teams. The protocol itself has been embedded in policy. And the key thing that Rutgers helped us with was making the document a fluid document. So as the risk assessment teams go through it, it can be modified and adjusted during the year to fit the needs of the team. So resources need to be updated, practices and protocols could be updated. And Rutgers was instrumental in not only helping us implementing it, but making it an ongoing process. Another great piece about the Rutgers program and how it operates at Copeland Middle School is really using them on the consultation side, where we have high profile cases where we need an expert opinion. We don't have to go outside the building. We have the expert right here with us, or reachable by phone, or Google Meet or Zoom. And we've done that several times this year, where we've had our clinician work with our psychiatrist to really develop plans to help support students who need it the most. Next slide, please. The biggest lesson that we've learned at Copeland is that staff training and buy-in is key, and that the professional development that we provide in the area of mental health has to be intertwined in everything we do. We are coming up in our 5-year curriculum revision cycle. Our social studies curriculum was rewritten this year. Within that curriculum, restorative practices, mental health and wellness components have been embedded into the curriculum, and that's been done in consultation with Rutgers. As I mentioned, if it's a one-off program or a program that's going to operate in a silo where the clinician doesn't know the team members, the clinician doesn't have a great grasp of the school, and quite frankly, if the clinician doesn't work closely with the principal and the central office team, I don't feel that would be, an effective program. And, our clinician, our team is the exact opposite of that. We've learned that affiliations with specialized community partners can improve access to programs for our students. And really coming in is really debunking the stigma that's attached to mental health. Has to be at the forefront, especially now in the times that we're in the mental health crisis that we're in. Operating together and operating like a community, is essential. So I'd like to thank everyone for their time. That's it. Thank you.
Thank you, Principal Ganella. Before we move on to our question and answer portion of the webinar, I wanted to get some feedback from the audience. And we did have a poll that I'd like to launch, if we can now, Kati, just to learn more about some of the existing school mental health partnerships that your schools or districts might have in place. And so if you could take a moment to answer the question of the poll that should have come up on your screen. Does your district have existing school mental health partnerships? We'll just take a few moments to answer that question. I appreciate hearing from everyone. Okay, and so 100% of the 2 responded yes. Great. So thanks so much for participating in that. Feel free to add to the chat any other comments that you might have, your experiences. That would be great. And now we're going to be taking some time for some questions from the audience. If you have a question for any of our presenters, please feel free to drop them in the Q&A box. But I'm going to start with some questions that we've already received. And so for Principal Ganella, but either presenter, Sonia, you can also feel free to respond as well. But this was specifically for our school. How did your relationship develop with specific partners, and how did they evolve over time?
That's a great question. Again, so I mentioned we were a survivor school, so our superintendent at the time was looking for additional resources, and I was able to meet Sonia and her team. And the thing that we hit it off instantly, and really dialed through what our needs were. We thought it was important that the district be involved in the hiring process of the clinician that would be at the school, that essentially would be hand selected by the school in conjunction with Rutgers. So we're looking for someone who obviously had the clinical background, but we're looking for someone who would be a fit for our students and for our staff. That was a pretty cumbersome process. Again, I can't remember how many we interviewed, but it was quite a few. It was weeks before we really nailed down a candidate that we liked. The partnership initially, I can say, had its bumps. Really figuring out who we were as a school, but really determining the mental health needs of our staff and how the clinician can support the decision makers in the building was instrumental. And that really forces you to look in the mirror and really be open with the people that you're working with. We hit it off immediately. Being receptive to feedback is key. It's also important for the clinician to be receptive to feedback, because the clinician is looking at it from a clinical standpoint. There's certain things that administration looks through when you dial through a code of conduct or policy. Sometimes those worlds don't totally jive. So the evolution, I would say, happened relatively quickly, but it happened quickly because Sonia and our team had a strong relationship, and the clinician had a strong relationship. So when we meet, it is as authentic as authentic could be. And we really look for ways to integrate Rutgers into everything we do. And that's not always an easy piece. Schools sometimes just silo things out. Curriculum is one thing, instruction is another piece, counseling is another piece. What we've been able to do is make that a more cohesive unit. And that happens because the clinician, myself, we meet officially on a weekly basis. We go over things like school culture and climate, risk assessment, HIB. Those are three pieces that we never deviate from our agenda. So it's not just a case review of those things. It's how we can get better and how we can support our students, staff, and community. So making it something that constantly evolves and executed is key. And you can't do that if you don't have a strong relationship with the provider.
Thank you so much, Alfonso. And, just the importance of relationships and the process of developing it. And also, as you were mentioning, really interviewing different candidates, or, trying to get a better sense of what your needs are and what's offered is really important for that collaboration to work. Sonia, there are two questions here. I'm going to start with this one. At what point in the process of developing a comprehensive school-based mental health program do you start communicating with system partners, and how do you know when you need additional support?
Great question. I think the process is consistently ongoing. So it's so important to have regular conversations with the school district about what the needs are, how to get started, what does this look like, who are the key players, who do we need to get involved. And then also constantly coming to the table and saying, where are we at? Data helps, because we're always looking at how many students are being served, how many students are being referred, how many are on a wait list, how many students are participating in groups, how many families are coming to family sessions and participating in parent workshops. And so we work from the approach that it's important to come together at the mid-year, provide that data to the school district, have a conversation about how things are going. Are we meeting the needs? Do we need to shift programming in a different direction? And then we do that again at the end of the school year to really tie up all of the programming that occurred at the end of the year, and then to determine what planning looks like for summer and for the upcoming school year. So I think it's really important to just come together, look at the data, sometimes even looking at specific cases and ensuring that the community partner is meeting the needs of the school district, and really looking at trends again. I had talked a little bit before about trends. What are some of the trends, and how do we plan and program to make sure we're meeting the needs and providing programming to support the trends that are coming up. So I would say it's really just about a constant collaboration. Thankfully, we have program managers that really work very closely with the school districts. They're on site once a week to help support the clinicians and other school staff, other clinical staff, as well as meeting with the school administrators to kind of check in and make sure that things are in a good place and that we're meeting the needs. Thank you.
Thanks, Sonia. And I think, the emphasis on teaming and, constant communication, which you stressed in your presentation, so important. And also the use of data, not only in terms of needs assessment, but checking in along the way, looking at those outcomes, looking at those identified, data sources, and seeing how things are going in that constant evaluation. So important.
Sure, and just to add to that, we identify that there's a greater need if the clinician is really feeling like they're not able to meet all of the needs of the students that are referred. And a lot of times we also look at the number of crisis assessments that are completed and how many times a clinician might need to be pulled from their typical duties to go and complete a crisis assessment. Because one of the goals of these community partnerships is to keep kids out of the ER and making sure that they can receive the supportive services in-house. And if they need to be hospitalized or need a higher level of care, that someone at the school can assist with facilitating that process, as opposed to having them sit in the ER for several hours for a screening.
Sonia, and working together to identify, some of those important data, points and sources is really key. So one last question, and you touched upon this a little bit, but what should or can communication look like between school and system partners regarding specific cases?
So a lot of times the staff is invited to participate in 504 meetings, IEP meetings, INRS meetings. And so being able to consistently have staff participate in these meetings to provide an update, as well as consultation about what services or programs might be available to help support those students. We have logs that we use. So we have confidential logs where we track referrals, students who are actively being seen by our clinical staff. And that is usually shared with a select few administrators at the school level, so that they know who's being seen, how often they're being seen, and what the update or status is for those students that are being seen. Like I said, sometimes we have bi-monthly meetings. We always ensure that we have a mid-year meeting as well as a year-end meeting. So I would highly recommend coming together several times a year to discuss the program in partnership.
Thanks, Sonia. Really helpful information and insights. And I just want to thank you both again for participating today in our webinar. We've run out of time here, but really appreciate all the information shared. And I am going to turn things over now to Kati, who's going to explain the evaluation portion of our session today, and then some other important closing information. Thanks so much.
Thank you.
Thank you, Alicia, and thank you again to our webinar presenters for today. Next slide, please. On your slide, we will see a QR code, and this QR code will automatically link you to our evaluation survey. The link is also shared in the chat box if that's easier for you. As a reminder, we invite you to complete these surveys and provide as much anonymous feedback as you would like regarding today's event. Next slide, please. We also invite you to check out our podcast, Toward Wellness and Recovery, and you can find it either on Spotify, Apple Music, or Podbean. And this is intended for a helping plan for helping professionals, and it's part of our Flourishing at Work series. Next slide, please. And on your screen, you'll see some contact information for our center in case you have any questions regarding our products or resources that we shared with you today. Next slide. And that will conclude this session, our final session. Again, we want to thank you for joining us today. We want to thank our webinar presenters, the New Jersey Department of Education, for this collaboration. And we hope that you will join us again in the future at our upcoming webinar events or other training events that we have scheduled. Please be sure to have enrolled in our mailing list so that way you'll receive our training announcements. And we hope you have a great rest of your day. Thank you.